Good evening, everyone, and thank you for joining the Equal Hope segment on CAN TV. My name is Leilani Lacson, Soltesiac, and I'm so happy you can join us this evening. So for those who are not familiar with Equal Hope, we are a nonprofit organization in Chicago whose mission is to help eliminate health disparities in Chicago. So we do this by offering free mammograms, cervical cancer screenings, linking people to primary care providers, providing assistance with vaccinations, and much more. You can find us at equalhope.org or give us a call at 312-942-3368. You can also find us on social media at equalhope_IL. And just wanted to mention that for Breast Cancer Awareness Month, we have something called the Restaurant Tour going on. Visit our website at restauranttour.com for more information and to learn more. So September is Alopecia Awareness Month. Here to talk with us about this is this month's guest, Dr. Victoria Barbosa. She's an associate professor of dermatology at the University of Chicago, the director of the hair loss program, and the director of diversity, equity, and inclusion for the dermatology section. Dr. Barbosa has also been on our Saturday morning radio show. Thanks for joining us today, Dr. Barbosa.
Thank you so much for having me, Leilani, and thank you for all of the important work that Equal Hope does to advance the health of all communities.
The goal of Alopecia Awareness Month is to increase awareness, reduce stigma, and empower those living with alopecia locally and nationally. Alopecia affects about 2 out of 100 people, causing hair loss that may come and go over a patient's lifetime, or the hair loss may be constant. It's the second most common form of hair loss. So let's get into the discussion. Dr. Barbosa, tell us a little bit about yourself.
So I am a dermatologist, and dermatologists are people who are medical doctors who treat the diseases of the hair, skin, and nails. I specialize in diseases of the hair and scalp, particularly hair loss. I see patients at the University of Chicago and love taking care of both the dermatologic and, the emotional issues that stem from living with hair loss.
So describe what alopecia is for those who aren't familiar.
That's a great question. The word alopecia really scares people, but alopecia really just means hair loss. And what I like to stress to people is that it's important to know that if you're having hair loss, but it's more important to know why. There are many different causes of hair loss, and they have different prognoses and different treatments. And so all hair loss or alopecia is not the same. And we really have to get to the root, if you will, of what is causing the hair loss so that we can treat it. I think it's also important for people to know that, as with many other health conditions, making a diagnosis early and developing a treatment plan early leads to much better outcomes and more hair on your head.
What are the typical symptoms of alopecia besides hair loss?
Right. So the answer to that really depends on what kind of hair loss you're having. So for instance, there are some forms of hair loss, like male or female pattern hair loss, that occur as we get older, often runs in the family. Um, Male or female pattern hair loss usually doesn't have any other symptoms. However, there are forms of hair loss that are caused by inflammation of the scalp. Some of them very common with very, long names like central centrifugal cicatricial alopecia, very common in Black women. Some very uncommon, like lichen planopilaris. And I don't expect anybody to remember those names. But the point being that sometimes you've got an inflammatory scalp disease that causes itching or burning or tingling or creeping or crawling sensations in addition to the hair loss. And so I think it's important for people to know that having scalp discomfort is not normal. Now, it's one thing if it's getting towards shampoo day and you're a little itchy.
Mhm.
But if you are itchy out or uncomfortable out of proportion to just, having a little dandruff or needing to shampoo, it's time for a scalp evaluation.
So, how is alopecia treated typically?
So that's a great question. And that answer, again, depends on the type of hair loss that one is experiencing. So, first of all, if a person's own hairstyling or grooming is contributing to the hair loss, we have to discuss that. So, for instance, there's a really common form of hair loss called traction alopecia. That's the hair loss that occurs from pulling of the hair at the front hairline. So, we see it in ballerinas who wear tight ponytails. We see it in some people with different religious backgrounds who wear their hair pulled back tightly. We see it a lot in Black women from braids and twists and weaves. And so the first thing we have to do is identify what grooming practices are contributing to it and then eliminating those. Then there are so many different treatments. Again, sometimes people need some anti-inflammatory treatments for the inflammatory forms of hair loss. And that could be in the form of topical steroids or steroid injections, or sometimes even oral anti-inflammatories. And then we also will often add in something topical or oral to stimulate regrowth. And one of the most common ingredients is minoxidil. So topical minoxidil has been around for a long time. And minoxidil, it's interesting, was actually originally a blood pressure medicine. And when they were treating people's blood pressure, lo and behold, these people started growing hair. So it was formulated as a topical for ease of treatment of hair loss, but now we're back to using it as an oral medication, often alone or in conjunction with other medications. So I think what I'm really trying to convey is not to make the audience expert in the treatments of hair loss, but to say this: there are options. And it breaks my heart when people come to my clinic when they've been experiencing hair loss for 5 years or 10 years or 20 years, and they've been told, sorry, there's nothing you can do, when in fact, there's always something we can at least try.
Great. And those are some questions I was going to ask you about later on as far as treatment, other options. So, who typically gets alopecia? Is someone more likely to get it? Certain groups, ages?
So that's a great question. There are some forms of alopecia where we see it kind of equally in all people, like male or female pattern hair loss. But there are some forms of hair loss that we see more commonly in different groups and sometimes more commonly in people of color. So for instance, initially we talked a little bit about alopecia areata, which is an autoimmune condition. And autoimmune conditions often run in the family. So it's seen in people who have a family history of autoimmune disease. And for some reason, we see it more commonly in Black and brown people. So in people of African descent and Latinx populations, both men and women. And then I also mentioned two very common conditions that we see disproportionately or almost exclusively in Black women, being CCCA or traction alopecia. And if I can say one more thing about that, CCCA is a form of hair loss that we see because it has a genetic component. So there's a genetic reason that we see it more commonly in Black women. Traction does not have a genetic component. That's purely based on our styling. And so it's really interesting because you can have kind of a genetic component or a cultural component, right? Based on the popularity of wearing braids or weaves for extended periods of time. And those cultural factors can contribute to seeing a disproportionate amount of hair loss in Black women.
So pretty much you need to get to the root of the cause.
Absolutely.
So there are some people who may panic when they see lots of hair in the shower drain or when they brush their hair and they look at the hairbrush and see a big clump of hair. So tell us what normal hair loss is versus the severe spectrum, the severe end of hair loss.
That is such a great question. So, first of all, know that losing about 100 hairs per day is totally normal. It's also totally normal to lose a little more of that hair at shampoo time. And that's particularly true for people with curlier hair who maybe don't comb or brush their hair so vigorously on a daily basis. Now, there are times where people will see all of a sudden they're finding clumps of hair. That's another common form of hair loss called telogen effluvium. And that is really kind of a stress induced hair loss. And I define that stress broadly. So it can be a physical stress like an illness. And one of the biggest culprits of the last 3 years has been COVID. So I think a lot of people know you get COVID, you get better, but 1 to 4 months later, clumps of hair. It can really be any illness. We also see that kind of hair loss after life stress or during life stress, marriage, divorce, exam period in our college students, a move, a new job, any life stress can cause just clumps of hair, not just at shower time, but anytime. Even though that's one of the scariest forms of hair loss for people because it's so sudden and so dramatic, the good news is that that hair loss is actually reversible even without any medical intervention. And usually somewhere between 4 months and a year, it will slow down and that hair will grow back.
Okay. So that's good to hear. There are options and hair will grow back with early treatment.
Yeah, yeah.
So how common is alopecia in your clinic?
In my clinic, 2.5 of my 3 days per week on average are all hair loss patients. And I am booked out until next April.
Oh, wow.
Right. So when I tell you it's common, it's common.
Yeah.
And one of the reasons that I'm so glad that you're allowing me this time is because what I'm realizing is people don't even know that the dermatologist is the doctor that they should see. So we actually even did a study on this a couple of years ago. So where do people go? Well, they go to their friends and their relatives, right? They trust their stylists, which is great because there are many great stylists, and many of my patients are referred to me by hairstylists. And sometimes they even go to their primary care doc, to their internist or family medicine doc or their OBGYN. But what happens sometimes is, your family doc or your internist is trying to manage your blood pressure and your diabetes and, four other, conditions. And even when hair loss is maybe the most pressing issue for the patient, it doesn't always get addressed. And so unfortunately, a lot of people don't get to and then they have to know, oh, I'm supposed to see a dermatologist. And then we have a 6-month wait. So so there are some, so there are other sources people go to, but what I want everyone to know is that dermatologists are the doctors who are the experts in treating hair loss.
That's important to know because like a GP or an internist, there's only so much they can help you with. And as far as like the breadth of their knowledge isn't as expanded and wide.
And let me say this. So our primary care docs are amazing and they can more than handle the common forms of hair loss, the male or female pattern, even identifying the stress shedding called TE. But sometimes their plates are full, right? In a visit, if they, again, talked about your insulin and your cholesterol and your blood pressure, sometimes hair loss just doesn't make it onto the list. And sometimes they've tried to treat the condition and it's not getting better, and then it's time to refer to us, for sure.
For specialists. So help address the stigma around alopecia.
So I'm so glad that you asked this question because, the four walls of a doctor's office are a very sacred space for patients, especially when they feel a level of trust and comfort with their doc. And I think most of my patients know that I love taking care of them. And so we have some very open, candid, and raw conversations. And hair loss, really, for a lot of people, is not just about their appearance, but it's about their sense of self, right? A lot of people feel like their hair is their crown and glory, and they're losing that. They had thick, fabulous hair that was a source of compliments through their 20s and 30s, and that's going away. And it's an identity crisis. They feel sad. They feel all kinds of things,
Mhm.
embarrassed, and nobody talks about it, right? Nobody at the Thanksgiving table ever snatched their wig off to reveal to their loved ones the extent of their alopecia. It just doesn't happen. And so what happens is people end up feeling very alone, very embarrassed, and like they're suffering in silence. And in fact, they are suffering in silence because people don't talk about it so much. Now, what I will say is that social media has started to change that narrative, as have brave people. Like, I think a lot of people with hair loss are aware of the state rep from Massachusetts, Diana Presley, who just stopped. She's a national political figure who stopped wearing a wig and said, "This is what I've got.
Mhm.
I'm dealing with this." People, celebrities like Jada Pinkett Smith, right,
Mhm.
said, "Listen, I have alopecia." So I think that just like with other skin diseases like vitiligo, I think the narrative is starting to change, but we have a long way to go. And until we're able to talk about it openly, um, men and women won't be fully empowered to take care of themselves physically and mentally.
That's really great that you have a space for patients to talk to you about a subject that can be really difficult.
Yeah, I'm actually, unfortunately, this year's is already sold out. But because I recognized the need for patients to have a safe space,
Mhm.
I've started a hair talk forum.
Oh,
We're doing our first one in a few days, actually. But again, it sold out, very quickly. But I'll be planning more. Um, and there's what I'm able to give people in the doctor's office, but people have questions for hairstylists and product development specialists and therapists and transplant surgeons. So I'm really also creating space outside the exam room to have these conversations because there's only so much we can do in a 15-minute visit. So I've done several different things over the years during, depending on what works at what time. So we've done in-person support groups, we've done through the pandemic virtual support groups. So I'm really enjoying building the hair loss program and having additional offerings as we grow.
what's the turnout been like for your events?
Well, that's a great question. The support groups I try to keep small
Mhm.
because you really want people to have a chance to be heard, right? And my role is minimal in the support groups. My role is to bring people together because there's something that people get from each other when they're having a common journey or a similar journey.
Mhm.
And so my goal is to fact check and to make sure that no misinformation gets perpetuated. And so usually I'm looking at around 20 to 30 people in those groups, and I'll cap it at that. And that's even pretty big. But Zoom let us do that. I tried to be closer to 20 when we did them in person.
Oh, okay.
Um, yeah. Again, it's such an intimate topic that it's
Mhm.
important that people not feel overwhelmed. And the more people are there, the less people are apt to speak up and share their voice.
So, how can we prevent alopecia?
So that's an interesting question. Some forms are preventable, right? So having great hair care practices and great styles where you're not putting tension on the hair is very important. So if you get braids done and you need, pain medicine, maybe it's not the best braider and you need to find someone else. Rotating hairstyles is very important. You shouldn't stay in braids or crochet or weaves for 2 years straight. It's not, giving your follicles a rest. But other than that, maintaining your, keeping your stress levels low, it won't completely prevent it in someone who has an underlying predisposition, but it can certainly help. So practicing great wellness and taking care of your mental health is very important. And then again, there are some forms that are inevitable because of your genetics. And in that case, the most important thing you can do is not be afraid to go to the doctor, not be afraid of what we're going to say, to find the right person who embraces caring for patients with alopecia, and getting treatment early. One of the other things I'd like to mention is that sometimes the form of alopecia isn't evident just by looking with our naked eye or with a dermatoscope, which is a fancy magnifying glass. Sometimes we have to do a biopsy because we want to get a piece of skin to look under the microscope and have our dermatopathologist look under the microscope at those follicles to see, is there follicle damage? Is there active inflammation? Are the follicles gone? Right? This is important information. And I want people to, sometimes when we recommend a biopsy, people get scared and they don't come back until they work up their nerve. And sometimes that takes years. And that's just more time lost and more follicle damage lost. So I'd encourage people not only to go to the dermatologist, but also don't be scared of our advice if we want to dig a little deeper to understand what's going on with your scalp.
That's some good advice. So we have less than 5 minutes left in our conversation. Do you recommend any over-the-counter products?
That's a great question. So you've had a lot of them because I keep saying that. So people will often ask about hair growth supplements. And what I would say is there are more on the shelf that are not studied than there are supplements that have been studied and demonstrated to be effective. So I'd always be cautious of spending too much money on supplements unless they can tell you that they've got some research behind them. As I mentioned, topical minoxidil, and there are several different brand names that I don't want to mention specifically because there are several options, but topical minoxidil is always a good start no matter what type of hair loss you have. So let's say you call to make an appointment and they tell you it's going to be 3 months or 4 months or 5 months. You will never hurt yourself by starting on minoxidil topically while you wait. And maybe you'll see some improvement. Oh, may I say one more thing? That reminds me that sometimes when we talk about topical minoxidil, people say, oh, I hear you have to be on that the rest of your life. And here's what I'll say. There are some forms of hair loss, like the stress shedding, that reverse on their own. But for most forms of hair loss, not all, but most forms, they only go in one direction if we don't treat them. And that's, downhill. Now, do you have to be on treatment for the rest of your life? You don't have to be because, I always joke, I'm not saving any lives in hair loss clinic. Okay, so you don't have to do anything. But if you want to hang on to the hair you've got and potentially bring some back, and we see that you've got a scalp disease, then you're going to want to do something for the long term to keep the hair you've got and to bring some back.
Well, Dr. Barbosa, this has been a really great conversation, and I appreciate you taking the time to talk to us about alopecia in honor of Alopecia Awareness Month.
Thank you so much for having me and for, bringing important information to the community.
Thank you. Well, that's all the time that we have for now. Join us next time on October 24th from 5 to 5:25 p.m. Our next show will be about Breast Cancer Awareness Month, and Dr. Lauren Green will be our guest. Don't forget to visit our website, restauranttour.com, to learn how you can get involved and how you can help. Thanks for watching, everyone. And also equalhope_IL on social media. That's where you can find us, equalhope.org. And you can call us at 312-942-3368. Have a good night.